Assalamu alaikum. Dr. Rashid Mahmood here. In this video, we will discuss the guidelines for the pediatric blood pressure measurements, its plotting on centile chart, and interpretation that whether the patient falls in the stage of hypertension or normotension. So, as per guidelines given by 2017 American Academy of Pediatrics, the recommendations are that every child above age of 3 years should get her annually blood pressure checked, and it should be plotted. Second is that children with a risk factor like those with obesity, chronic kidney disease or diabetes should be checked for blood pressure on every visit. So these are different. Blood pressure is checked by the sphygmomanometer with the cuff sizes of different sizes cuff, as shown here: the neonatal size, infant size, child size, and adult size. The cuffs is very important in the sense that if cuff is loose, blood pressure will be lower and it will be false. Again, cuff is very tight, blood pressure will be elevated and it will be false elevated. So size of cuff is very important, and this thing is being noted in during exam setting also. So cuff should be at least cover the length of cuff should be at least 80 to 100% of the upper arm circumference, and the length should be 80 to 100% of the upper arm circumference, and the width should be at least 40% of the arm circumference. So these two requirements should be met. So cuff bladder should encircle 80% of or more than that of patient's arm circumference. This is a requirement for pediatric size cuff. So mercury column should be deflated at 2 to 3 millimeter per second. If the rate of deflation is higher, there are chances that the reading will be false. Once you check a blood pressure, you don't label a patient on the single reading that patient is hypertension. So you have to repeat it and confirm it because hypertension will lead to a significant change in life as well as ecological and issues into the parents and to the kids. So before labeling a patient as a hypertensive, you have to take great care. You have to repeat the reading. Now, if patient comes and you check blood pressure and it falls in case of hypertensive emergency or urgency, then there is nothing to wait. You have to start treatment immediately. So as per guidelines, that elevated reading should be confirmed on repeat visit before determining that a child is hypertensive. The BP should be measured with the child in seated position after a period of quiet for at least 5 minutes. So when child comes, make him sit, relax, watch him some cartoon or talk to him, and then after 5 minutes take blood pressure with appropriate size cuff. And it is recommended that BP is checked 3 times with average result is taken. Now there is a term is called ABPM, that is ambulatory blood pressure monitoring. So there are two types of hypertension which are difficult to diagnose. One is white coat hypertension and another is masked hypertension. White coat hypertension is a false hypertension where a child when gets in a hospital setting, his blood pressure due to adrenaline anxiety gets elevated. And masked hypertension is that opposite of it, that in hospital setting his blood pressure comes as normal. So answer to both of these conditions is ambulatory blood pressure monitoring. So this is a table showing the rough estimate, a screening table you can say, for the blood pressure. Once you take blood pressure, you come to this table and look that whether blood pressure of the patient is within range or above. If it is below the age of the recommended sex blood pressure, then you can relax. If it is elevated, then you have to go for the next step. So in this table you can see the age from 1 to 13 years who have two genders, the boys and girls, and systolic and diastolic blood pressure. So take blood pressure as appropriate and then go into the gender column and then go into that age column. So if it is less, okay. If it is more than that, then go for the next step that I will show you next. So you have to plot the blood pressure of every child. The blood pressure plotting is very important, that in the sense that in pediatric age group the blood pressure is very variable. It depends upon multiple factors including the height of the child, gender of child, and age of child. So it is variable and it depends upon these multiple factors. So you have to follow these things. So in this blood pressure centile chart, you can see that different things are shown. One is the gender. So as you see here, the boy, it is for the boys. Similarly, it is for the girls. on you now come to the left side, the age is mentioned. So age is in 1 year, 2 year, 3 year, and we follow it till the 13 years. After 13 years we follow adult guidelines, and there are two columns. One is for systolic blood pressure and other is diastolic blood pressure. And the next thing is the height percentile. So you have to first take the child's height and plot it, and according to that percentile you will then look for blood pressure percentiles. Now I am given an example that a boy comes with the age of 3 years, and whose height percentile falls on 25th centile, and whose blood pressure is 90 by 50 millimeter of mercury. So 90 is systolic and 50 is diastolic. So how you are going to plot that? So first you have to go for take the percentile chart of that specific gender, that is boy. So I have taken the boy's chart. Second is that you will mark the age of child. So here age is 3 years, I have marked it. Third is that you will go for the systolic chart and diastolic chart, and you will mark the height centile line. So it is 25th centile, so we will mark it 25th centile and we will move downward. Now the blood pressure, as I have told already you, that it is 90 by 50, so we will mark it. So it is between 89 and 103 in systolic and 45 and 60 in diastolic. So we will follow back to the BP percentile line. So it is coming between the 50th and 90th centile. So in this way we will plot the centile chart. Now the recommendations regarding blood pressure in pediatric age group are that if it is less than 90th centile, it is normal blood pressure. If it is between the 90 to 95th centile, it is elevated blood pressure. If it is more than 95th centile, then it starts stage 1 hypertension, and stage 1 hypertension persists from 95th centile to the 11 millimeter of mercury. And if blood pressure is 95th centile plus 12 millimeter mercury or more, then it is labeled as a stage 2 hypertension. This was a brief review of pediatric hypertension. I hope you have got something new from it. Thank you.